In this course, we're going to start with some basic patient care skills that we use to help improve movement. But before we start thinking about interventions that we use to help improve movement, we have to have a shared understanding of the vocabulary around examining how diseases and health conditions affect movement. And that's what disablement models do for us. The first model that I want to study with you is the Nagy model for disablement. And that was the first model that started to look at how does disease or pathology affect the person, the patient, and how does that and how can that change with each individual. So in the Nagy model, there's really 4 levels that it looks at. It looks at the pathology, which is the presence of disease, and then how that disease might lead to impairments, which is loss of function within the body, and then how those impairments can lead to limitations in function, which is how the whole body moves. And finally, how does that loss of whole body movement affect how that person or how that patient can engage with the world? And that's disability. So let's take a closer look. But before we do, it's important to think also that the Nagy model really started to think about the individual nature of the disease experience. And Nagy called these external modifiers. And these become something else later on as new models are adopted. But I think this slide gives us a nice example of things that a person might have in their history, in their personality, in their life experience that affects how a disease might impact their movement and their activity. So for example, if you look at the first item, a patient who is very athletic and active and exercises daily, and compared to a person who's relatively sedentary, should they have the same disease, the same pathology, they may experience different effects to their movement as a result of that pathology. So the Nagy model started to take the individual differences between patients in account when looking at how movement and activity is affected from pathology and disease. So these are the terms that you're going to want to study and really have good working definitions of. So pathology is any disease. Pathology is the role of the physician, or the nurse practitioner, to diagnose. And they look at what is going on in the body that's a pathological condition on a biological or cellular level. The pathology, the disease process, is certainly influenced by other diseases and conditions, and those are called comorbidities. They're influenced by the patient's general health and also where they are along the age continuum, whether or not they're young, middle-aged, or older, and how healthy those biological tissues are by supported with good, average, or poor nutrition. So again, pathology is really looking at biological changes in the body. So from pathology, then you can expect, well, what impairments will result. So those are losses of body functions. So you start to think about if you have a disease such as a lung disease or a heart disease or a muscle disease, what sort of impairments can you expect? Well, you might expect losses in strength, losses in endurance, losses in flexibility. So those are impairments of the musculoskeletal system. Those are impairments perhaps of the neuromuscular system, and they change how your body functions and certainly contributes to illness. Those things can be measured through a loss of range of motion or through observation, but they can also be reported back by the patient. The patient may tell you that they feel weak, or they may tell you that they feel painful. so they can be measured or something reported back from the patient as their own experience. Now, this is an important point. A patient may have an impairment, so a loss of range of motion, for example, but that doesn't necessarily mean that they can expect to have a loss of physical function. So let me give you an example. Let's say you have a patient who has a loss of range of motion in their shoulder, and they're not able to reach a full 170 degrees overhead. Well, if they don't have to do that movement in their everyday life, if they don't need that 170 degrees range of motion, then they don't experience any loss of physical function. So there isn't this linear relationship between a loss of between a diagnosed or a measurable impairment and a loss of physical functioning. In other classes, you'll be talking about the Guide to Physical Therapist Practice. And the Guide of Physical Therapist Practice uses clusters of impairments along body systems, such as musculoskeletal impairments or neuromuscular impairments, that help physical therapists kind of categorize different expected presentations based upon impairments. Let's talk a little bit about functional limitation. These are things that can affect the whole person. These are basic physical and mental actions. And some examples on this slide, such as difficulty with walking or not able to put on shoes, would be a functional limitation that resulted with a decreased endurance or decreased flexibility due to a pathology. So you can start to see that kind of chain of events that takes place, that the pathology can lead to an impairment, and depending on the patient, that impairment can make it very difficult for them to perform some basic physical and mental activities. So that's a functional limitation. And in physical therapy, we're always looking at function, and we're always looking to improve that patient's function. So physical therapists will often identify functional limitations in a physical therapy examination and plan of care that connects back to impairments, but really what we're treating is the functional limits and trying to minimize those and improve those. So when we look at functional limitations, and more importantly, when we set functional goals, we're always looking at what the patient wants to be able to do better with regards to their movement. And we have to consider the context, those external modifying factors. What goes on in that patient's everyday work and leisure activities where we can expect to help make improvements. So again, functional limitations connect to functional goals, which are measurable and patient-centered. This is probably the hardest construct for students to understand, and we're talking about disability. So these are social roles, where we're looking at what does a person expected to do as a human being in our society. What is a person, an adult, a child, an older adult expected to do? And a disability can be temporary or permanent, and it's really describes a gap between what the person can do and what they need or want to do. And I think fundamentally, if you're going to remember anything about disability, I think that second bullet point provides a very concise way of thinking about disability. So again, it's about how the condition, the health condition or disease, impairments and functional limitations affects the person's role in society. And there's some examples here where someone who has diabetes may not be able to walk, which is a functional limitation. And if they can't walk and they're a mail carrier for the post office, well, now they're unable to work. So unable to work is someone who cannot fulfill their role in society. That would be an example. Cardiovascular disease is another one. If you have a child who has cardiovascular disease and has decreased endurance and strength as a result, they may not be able to engage in the classroom and learn in a traditional classroom in an unrestricted way because of their endurance limitations. So those are a couple of examples. So again, disability is not linear, just like we talked about with impairments and functional limitations. Because the patient is always at the center, the impairments and functional limitations are going to affect different people differently. So you can have two patients who have the same disease, similar impairments, but they have different levels of disability. So let's look at a clinical example. I have two of these. The first is looking at an ankle sprain. You have someone who's got an ankle sprain. Their pathology at the cellular level is that they've got a soft tissue injury. They've had a tear to the supporting ligaments that connect one bone to another. The result of this soft tissue injury results in swelling, which affects the range of motion. So now they've lost range of motion at their ankle. And the functional limitation to this range of motion loss is they're not able to walk. The ankle can no longer move freely, it's painful, and they can't walk. And if they're not able to walk, and they're a healthcare provider, so a PTA, for example, well, you're not able to work. You're not able to work with patients. So here's an example of how an ankle sprain could lead to a certain level of disability in a PTA that may be different than someone who has a different occupation or different societal needs.